Jowls, they're one of the most problematic areas and something that really causes people problems. I get loads of questions. So today I'm going to tell you how to treat them. I'm going to tell you what to avoid, what non-surgical and home treatments might be helpful, and point you in the direction of what surgical options might be there. So what are jowls? Jowls describes the soft tissue area which protrudes from the middle of the jawline. Technically it's between the masseteric ligament and the mandibular ligament at the front, and this tends to increase with age for a number of reasons. So you have changes in the underlying tissues. This means the skin, the subcutaneous fat, the muscle, ligaments and bone, which all contribute to the development of jowls. So in terms of the skin reduces in size, it thins with age because of collagen loss, and that reduces some of the support. We have the subcutaneous fat. This redistributes, so some areas get a little bit bigger, some areas get smaller, and people often tend to gain weight with age, so this causes differences in the fat compartments. Overall, this redistribution and accumulation tends to result in a downward shift that's accentuating the jowls. In terms of the muscle, we have the platysma muscle, which is the flat muscle in the neck that goes up into the face. This tends to become a bit weaker and thinner with age, and again this tends to reduce some of the muscle contraction which supports the jowls. Over time, ligaments get weaker. Ligaments are really crucial. They're band-like structures that hold things in place. In the jowl we have the masseteric ligament, which runs from muscle to skin, and in the front we have the mandibular ligament, which goes from the bone up to the skin, and this is like a doorstop which really holds things in place. Over time even these become weaker, and we notice a forward shift of the jowl as it's enlarging in size. And lastly, we have bone. In the skeleton we have bony resorption. That means that the bone is often taken back up. In the front of the jaw, the mandible shrinks back, leading to squaring. We have loss around the prejowl area, and all of this contributes to volume loss around the chin area at the same time that the jowl is shifting forwards, causing a squaring of the face. So what's the problem with jowls? So they tend to make us look much older, in fact much older than many other aesthetic concerns that people have. One study in the Dermatological Surgery journal showed that on average people look about 7 to 10 years older when they have jowl formation, and as you get older that difference increases. So by the time people are in their 60s and above, the presence of jowls makes people look 10 to 12 years older. We know from other studies that people feel much less confident when they have jowls, and that's one of the most important things in aesthetic treatment, getting people's confidence back. In terms of youthfulness, we have symmetry and a strong jawline, and both of those things are affected significantly by the presence of jowls. Ladies tend to develop jowls at an earlier age, and I'm going to tell you about that in a minute. It's particularly problematic for ladies because we want a feminine heart-shaped face with cheeks that taper down to a chin, and when we have the jowls, this squares the face and is an unattractive feature. It's so important that almost 2/3 of people in one study cited jowl formation as one of their primary reasons for seeking aesthetic treatments. So this reflects the importance. So as I mentioned earlier, men and ladies tend to have the onset of jowls at different times. Ladies tend to have them forming first. So there are some gender differences in jowl formation. This is due to a number of factors. Men tend to have thicker, oilier skin with more collagen density, and this provides some structural support that ladies might not have. Also, through the perimenopausal period, ladies tend to lose collagen at an accelerated rate. This accelerates skin sagging and loss of structural support. Ladies have a higher proportion of fat within the face, and this is often a youthful feature when they're younger, but unfortunately with the changes in fat that I mentioned earlier that occur with aging, this fat redistribution tends to accelerate jowl formation even more. Ladies tend to have a more delicate, thinner platysma muscle from the neck into the jawline, and therefore as that thins with age, that loses the support more than men who have more bulkier muscles. And because men have stronger muscles generally even higher up around the midface, this again will tend to lead to structural support that's not present in ladies. On the flip side, ladies probably are more diligent with skincare and SPF, although men are tending to catch up these days, but that's probably not enough to balance out the anatomical factors. In my practice, most of the people I see are ladies coming with this problem, although there is an increasing tendency for men to want to treat it also. So what are the treatments for jowls? So firstly, I'm going to talk about home treatments for jowls. These are simple, non-invasive treatments, although the evidence can be a bit patchy, but certainly they would be part of an overall treatment plan and skincare regime. So first off, we've got facial exercises or facial yoga. So these are exercises that people do repetitively at home with the aim of strengthening the muscles and therefore improving volume and muscle strength around certain areas of the face. This could include cheek lifts, such as try to smile widely whilst pushing down on the cheeks, or jaw thrusts, where you're trying to place the head backwards and push the jaw forwards against resistance. So what is the evidence for home treatments with facial exercises? Well, there isn't an awful lot. There's a 2018 study in JAMA, which is one of the best medical journals, and this showed that a small cohort of middle-aged ladies who did facial exercises for 20 weeks showed that it had a slight improvement in terms of mid-face fullness and volume. This particular study didn't look specifically at jowls, but it did show that there were some changes. It was a small study. There was no control group to compare it against, so we have to be mindful about taking too many conclusions. All of the patients were middle-aged women, so we can't extrapolate this to older or younger people or men, but it did show that there was some improvement. The downside probably is that it requires excellent compliance. This group had to do facial exercises every day, several times a day for 20 weeks, and whether that's going to be practical for most people to do with busy lives is debatable. So there was a systematic review looking at facial yoga. So a systematic review is where all of the evidence is compiled and looked at by people who are experts in the field, and they look at the studies and they try and determine, is there enough evidence putting everything together? Unfortunately, all of the studies were rather small, they were poor designed, anecdotal, there was no blinding, so all of the things that we look for in a good study really weren't there. So the systematic review that was published came to the conclusion that at present there just isn't enough evidence to recommend facial yoga. Of course, that doesn't mean it doesn't work, but we just don't have enough evidence for it at the moment. So then we have facial massage. There's various different techniques such as kneading or trying to improve lymphatic drainage, and there are some proponents of this who claim it works wonders for their skin. Some dermatologists and other doctors recommend it as complementary treatment as part of an overall routine. It's thought that it might improve lymphatic drainage and blood flow and improve skin tone, but at present, again, we don't have an awful lot of evidence for this. Certainly for jowls, we don't have any evidence that facial massage is effective, although anecdotally some people claim it is. There was one very small study looking at CT analysis of faces that have had facial massage, and it suggested that it was a very small statistical difference in facial lifting with facial massage, but unfortunately there was only 5 patients, so again it's difficult to draw any significant conclusions from that. So in terms of egg whites, there's no specific evidence for this at all. There was one study that looked at egg cell membrane that was produced in a lab and put in a cream, and this showed a slight improvement in skin tightness. But as far as egg cells or putting eggs on your face, there's no evidence of that at all, unfortunately, at the moment. Many people like aloe vera for overall skin health and hydration. It's got limited effectiveness, although one small study with aloe vera did show that it improved the presence of fine lines over a period of about 10 weeks. Study, there was no control group, so that makes it a little difficult to know whether it was actually the aloe vera in the cream that was causing the improvement in the wrinkles. So when we're getting on to cosmeceuticals, that's the more medical creams. We've got retinoids, we've got vitamin C, and we've got hyaluronic acid, amongst others. So retinoids improve skin cell turnover and improve collagen production. Again, you've got to use it regularly and build up from a low dose. Again, vitamin C stimulates collagen production and can be good for pigmentation, and it's got antioxidant effects. With hyaluronic acid, much as the injectable hyaluronic acid that you might have in Profilo, has a real hydrating effect to the skin, so it can make the skin look fresher and plumper. So in terms of the cosmeceuticals, like the retinols, etc., we've got no specific evidence on jowls, but it is reasonable to propose that if they improve collagen and they improve skin health significantly, that they may be beneficial. Again, you've got to use these regularly over a long period of time, probably years, to see significant benefit. And alongside all of these, we've got healthy living. So we've got drinking plenty of fluids, particularly SPF protection, which is one of the most important things in aesthetic medicine. Exercising, not drinking too much alcohol. So we need water to maintain skin hydration. Diet rich in antioxidants in fruit and vegetables is going to be obviously beneficial. SPF to filter out the UVB and particularly UVA rays, which cause aging of the skin, is essential, and that's something that people should be doing really from childhood onwards. It's never too late to start. And I forgot to mention smoking. Smoking is not good for the skin. It causes vasoconstriction, so you have lack of blood supply, as well as the effects of the smoke itself on the skin. So now we're onto my sector, which is non-surgical treatments, and this includes things like fillers, Botox, device treatments, PDO threads, and the like. So if you start on one thing I don't recommend, it's PDO threads. This is something that some practitioners really like, some patients really like, but I think there's been a growing acceptance over time that they are very temporary and very problematic. So I used PDO threads for about 4 months or so before stopping. During that time, I had lots of complications in terms of bruising, feeling threads. Fortunately, no serious complications, but these do occur quite significantly with threads. And once they're in the skin, there's very little that you can do about it. Equally importantly, the effects are very short lasting. There is a slight lifting that might be evident for probably days or sometimes weeks. The threads completely disappear within a few months, and therefore the lifting effect for the cost and the side effects is probably not worth it in my opinion. So in terms of Botox, you might have heard of the Nefertiti lift. Queen Nefertiti was an Egyptian with an amazing jawline, and it's named after her. So with the Nefertiti lift, there's a couple of different techniques, but we're inserting Botox along the jawline and sometimes underneath the jawline with the aim that that might weaken the platysma muscle, which in turn will lead to an uplift. So in my experience, the effects have been generally very minimal, subtle at least, and I think it's arguable whether the benefits are worth the cost of the procedure, although it's generally quite a safe one. There was one study looking at the effectiveness of the Nefertiti lift, and it showed that the overall effect, when you're looking at all parameters, didn't actually reach statistical significance. This meant that it couldn't be distinguished adequately from the control group who didn't have the Botox. The only difference was in younger patients who had a very active platysma muscle with lines indicating that it was overactive, and those patients did seem to see an improvement. But for most people, especially older people with laxer tissue, and that would probably include most people with jowls, it's probably going to be of limited or no benefit. So we have fat dissolving injections. This would be Kybella in the US, also called Belkira outside the US. We also have other brands worldwide. In the UK, we tend to use Aqualux a lot. So fat dissolving injections have been around a long time, and they are quite effective in reducing fat in the area by about 20 to 25% per session. The effects are limited, however, by the side effects, which includes redness, and particularly swelling in the affected area, which is almost universal. So the swelling can last for days, up to about a week in papers, but I've had evidence of people having swelling for a couple of weeks. And of course, if you're having swelling in the area that you want to reduce, that's not great, although ultimately it will lead to reduction in size. There was one randomized trial looking at fat dissolving injections into the jowl, and this showed that they were statistically improved. Most people were actually quite happy and would have had it again, suggesting that in that study the side effects of swelling were manageable, and therefore the ultimate effect of shrinking the jowls was worth it. There are lots of devices on the market to try and improve skin tightening, like HIFU and radiofrequency. I personally use Morpheus 8 radiofrequency. That's a microneedling with electricity device that goes into the skin with little gold tipped pins, and that causes the skin to contract very slightly with the fibroceptal network underneath the skin, and the skin itself improves with collagen improvements. It gets about 30% thicker with 3 treatments. There was a study looking at Morpheus 8 along the jawline, and that showed with expert assessment and standardized protocols that there was a significant improvement in the jawline appearance with Morpheus 8 compared to the control group. And in that particular study, 93% of patients were really happy and would have had the treatment again, suggesting that subjectively at least it was also very successful. Now we're on to dermal fillers, which is one of my favorite treatments. Dermal fillers, as you probably know, are composed mainly of hyaluronic acid that is made in a lab, that's joined together to make a gel of different consistencies. So the treatment approach with dermal fillers should always be to treat naturally and anatomically, so you're trying to rejuvenate the face rather than over-enhance certain areas, because that's what scares most people. So HA hyaluronic acid fillers are really safe when they're done properly, and they're reversible, and also they're quite predictable. So when you place them somewhere properly, you can expect the results straight away. Many of the other treatments, you're waiting for improvement over a period of months. And of course, dermal fillers can be used with other treatments. It's often good to group treatments together to get the best effects. So with dermal fillers, you don't treat the jowl itself. That's a no-go area, but you might treat the area in front, and you might treat the area behind. In front of that, we've got the chin, and we've got the what's called the pre-jowl area where the marionette lines form, and at the back we've got the jaw angle. So as we age, the jaw angle at the back becomes less acute. That means it becomes flatter, particularly in ladies. It becomes flat, almost like a straight line from the back. You lose that nice angle. And in the front, the chin tends to shrink back and square, and we have this volume loss, as I mentioned earlier. So with dermal fillers into the front, we might place a dropper filler into the chin just to taper it slightly. And to the side of that, this is the marionette pre-jowl area. It will be reflating this with a medium filler, placing a slightly firmer filler from the chin to the jowl. So we're trying to lower the jawline slightly. This doesn't shrink the jowl, of course, but it can lead to a much more contoured jawline, especially when the jowl is not severe. Therefore, it's best in mild to moderate cases. Behind that, we can also place filler back to the jawline. And in a lady, which is most of the people we're treating with jowls, it's not about trying to widen the jaw. That would be masculinizing. So it's about placing filler underneath the jawline, just trying to stretch and elongate it. So I think the results from dermal fillers are one of the best of all of the treatments. Many of the other treatments are modest at best. So I like dermal fillers because they're so reproducible, and you know what you're going to get, and you can see an instant effect. When someone comes from an overall treatment plan, I might recommend a course of Morpheus 8 just to try and shrink and tighten the jowls just very slightly, and then place dermal fillers around this to get a nice contoured jawline. And then we have surgical treatment. So surgical treatment is undoubtedly the best treatment for actual stretching and repositioning of tissues. So you can do a lot with surgery that you can't do with other treatments, but there are some downsides, of course, to this, and not everyone wants to have surgery. So the best treatment surgically is probably a deep plane facelift, which can really stretch and reposition the tissues, and it lasts a relatively long time. Even with that treatment, it's not going to last forever, and if people think it's going to last forever, then they might be a little bit disappointed, especially with the cost in some areas of the world. It can, however, produce more dramatic results initially, but that has to be combined with other non-surgical treatments to make sure that the skin and soft tissues remain strong. There are other surgical treatments like a platysmoplasty or a mini facelift, but these are quite temporary and, in my opinion, might not be worth the expenditure and particularly the downtime. With all of the surgical procedures, there is a downtime. With a deep plane facelift, that might be many weeks where you're not able to go out, engage in social activities, might not be able to go to work. And of course, those things have to be factored in alongside the cost. Nevertheless, ultimately, when people have very significant laxity and non-surgical treatments aren't going to be enough, then surgery might be the best place to start. But again, this has to be done with non-surgical treatments. If you go to a surgeon and they're only interested in surgery, then you might be sorely disappointed over the long run. So with all aesthetic problems, one of the key things is to make sure that the tissues in the face, that's the skin, the underlying fat and muscle and ligaments, remain as strong as possible. There's lots of different ways to do this. One of the most important things generally in facial aesthetics is to make sure that the skin and underlying tissues remain strong. And I've got a video up here that you can check out which will explain all about that. So I will see you in the next video.